So you've decided you need a birth class, but you are drowning in all of the different options out there. Today, I'm going to tell you a few different things to differentiate which ones are going to be helpful and which ones might not be so helpful. Because I'm Hillary, I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I've definitely seen the difference between patients that are prepared versus patients who come in completely unprepared. And I do not want that for you. But the bad news is there are birth classes out there that are still going to leave you unprepared. So we don't want that. So let's jump into how to differentiate a good birth class from one that maybe just isn't your best option. As a side note, I taught birth classes for my hospital and people absolutely loved them. But it is a bit of a crapshoot as to who you are going to get when you book that birth class at the hospital. So I am a fan of the online ones where you can kind of see if you jive with that person or not. However, if you've had friends who've taken the birth class at the hospital and they've absolutely loved it, it might be a good option for you as well. It's just not usually my first line of defense, but they can be great. And I actually have a lot of people who take an online one and then they take that hospital one that is sometimes offered free or discounted as sort of a backup one as well. The first one is who is teaching it. Is it someone that actually has experience in the labor and delivery room? And I'm talking lots of experience. You're going to want somebody who's had thousands of births. Now, here's something that not a lot of people know, but we consider you a baby labor and delivery nurse up until you've been a labor and delivery nurse for about 8 years, because you need that time to see all of the different things in labor and delivery. And it's just really hard to become proficient until you've been there a really long time. And that really needs to be true of the people that you are learning your birth class from. Now, there are doulas and childbirth educators out there who do not have a lot of hospital experience. I don't want to put them down. I don't want to say that all those classes are bad, but I'm here to say that they don't have the experience, especially in interventions like C-sections, episiotomies, inductions, that really gives you that hands-on advice as well as the evidence in order to navigate those tricky situations. So that's why I prefer a birth class taught by a nurse, midwife, doctor, although honestly, I don't know that I would love one taught by a doctor. So take that for what it's worth. As a real surprise, I love the ones by nurses because I am the pregnancy nurse, but I might be a little bit biased. I mean, that's fair. The next one is, who are you wanting to do the class with you? Do you want to take the class entirely alone? Are you wanting to involve a partner in your birth preparation? Whatever way you're wanting to do that, make sure that your class is designed for how you want to do it. Now, it is true that a lot of times partners are not going to do like every minute of the birth class with you, and that can be accommodated by a lot of different classes. But if you want to get them involved, make sure that you're taking a class that actually involves them. A lot of classes kind of think of that partner as an afterthought, and that's just not what you want. You want one that really includes them and gives them tips throughout the class. The next one is hospital focused. If that's where you're planning on giving birth, you want to take a class from somebody who has seen most of their deliveries in the hospital. For instance, if you are planning a home birth and want information about home birth, don't take my class. However, if you're planning a home birth, but you might end up at the hospital, then my class would be great for you. If you are planning on a hospital birth, which is probably why you're here with Hillary, the pregnancy nurse who gets you prepared, not scared for hospital birth, make sure that you're taking a class from someone who is an expert at hospital birth. And I gotta say, there's a lot of classes out there who really put down hospital birth. Now, I'm not here to put down home birth. I just don't know anything about it. So I would hope that the same thing would be extended for people about hospital birth. And again, that kind of speaks to our first one. You're looking for a nurse, a midwife, somebody with those kinds of experiences so they can help you navigate the hospital. Because a birth class is more than just like learning the stages of birth. It will happen at hospital or home. It's learning to make choices in the hospital when you have them in front of you. Do you want to have an epidural? Your provider says maybe you want to have an induction. Navigating those choices is a lot of a birth class, even though people don't talk about that part very much. It really is so important to improve your birth experience. And if you're thinking, Hillary, I don't even know what I want, I recommend everybody get started on what they would like for their upcoming birth. I'm not saying that you're tied to this birth plan or it's set in stone, but it is nice to know what you would like in the hospital. Some people really love the idea of getting induced. They love being able to plan on it. And some people absolutely hate the idea of being induced. And so you kind of have to decide which one you are and then apply it to your situations as they come up during your pregnancy. I actually have a whole free birth plan series. I'm going to link it in the description, but it helps you go through a birth plan with that mindset of just what would you like in a perfect world so that you can apply it to making choices in the hospital. The next one is it on demand? I see a lot of virtual classes that are still offered just like like Tuesday nights at 7 p.m. And that doesn't fix a lot of the problem. So when I taught birth classes at my hospital, so often everyone would be there for the first birth class. And then the second birth class, I would notice one or two partners missing and another partner just like furiously writing things down so that they could educate their partner. The best part of an online birth class is that you can take it whenever both of you are available because schedules are just crazy. So just when you're looking for the birth class, understand if it's available all the time or if you're going to have to take it at a set period of time, or even if it's at a set period of time, can you watch it again later? These are things to find out. I am a fan of the on-demand ones. Honestly, when I filmed mine, that meant you got the cream of the crop. I filmed every section multiple times and I made sure that you got the one that didn't make me miss it. Like I didn't miss anything in it and you were getting the best of the information and I didn't misspeak. You're getting the cream of the crop when you pick an on-demand class. That's just my opinion from someone who's both taught at the hospital where I did forget things now and then just because I'm a human, versus filming an online class. Those are some of the differences. The next one is, does it cover the hard stuff? There's a lot of things that people just want to ignore. They want to talk about the physiology of birth, but then completely ignore that a lot of people end up getting induced or at least offering an induction or a C-section or forceps or vacuums or an episiotomy. And, those are not super uncommon in the hospital. I wish that we were able to use them less, but all of those things can be used in a very good way to both save lives and make birth better for families. But if you're just ignoring them, you're going to miss all those parts. In fact, I have a whole video on how people are ignoring these common interventions in their birth prep. And in there's a study that showed that none of the classes that they reviewed actually studied those interventions, like I mentioned. And so make sure that you get a class that is going over those. And again, you got to have an expert nurse or a midwife who can really go over those interventions with you, tell you what they're going to look like, tell you how to make the choice, go over the studies with you possibly, so that you can make the best choice for yourself when you're in this situation. Because if, we're 30 weeks, every single one of you is going to say, I don't want an episiotomy, but there are going to be times where an episiotomy is going to be your best choice. It is rare, but just knowing how to make the choice at the time is really important. The next one is it actually engaging? When I watch clips of birth classes online, I'm always surprised that someone is really engaging maybe on their Instagram or TikToks, and then they film a birth class and it's just like the Peanuts teacher where they're like, rah, 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 rah. You got to learn from the birth class, right? And if you're not able to take it in and actually use the information, then it's completely useless. So make sure that you're taking a class from somebody that's engaging and will really help you to actually learn the things rather than just like go through the videos. Because the ultimate goal is to help you feel prepared, and you got to be engaged and learning during the class in order to be able to do that. And I think one of the best things is to do some freebies to find out if somebody is engaged. I actually have a whole video on here about free birth classes that has some of those awesome freebies. I'm going to link it down below as well. And as a bonus, I actually have a free chapter of my birth class so you can see if it's a good fit for you. I'm going to link that, which I actually don't mention very frequently, down below as well, and you can jump in there and see what you think. Now, this is one that just chaps my hide because you have so many things calling out for your dollar bills when you were pregnant. There's so many baby things. There's so many medical things. You do not need a $400 birth class screaming your name. Take a birth class that's affordable. It does not need to be $400. I think that every single birth class should be under $200, even when they're including breastfeeding and nutrition and all these different things. A good birth class should not have to break the budget. And I have been really frustrated by some of the birth classes that are charging subscriptions because I know that after you have a baby, you are not going to be in the mindset to be able to cancel this unknown subscription that is billing every single month. I don't want that for you. I made sure that my birth class, you could do a one and done payment. I do offer payment plans if that's easier for you, but they end, you're just doing 3 payments. I'm just going to caution you on the ones that include a subscription fee. I think that is a predatory way to sell a birth class because they know you're not going to cancel. Just something to think about. Soapbox. Hillary's on her soapbox. And finally, does it have real reviews from real couples? People that you're like, oh, that sounds like me. Like, I'm scared about my upcoming birth, or it's my first baby. What do first-time parents think about that? Make sure that you're looking for the reviews on the birth class that relate to how you're feeling so that you can know if this is a good spot for you. And a lot of them offer money-back guarantees. Mine, you can buy it, jump in for 14 days because I want you to jump in and start doing it, not just wait and see if it's right for you. And if you're like, Hillary, we do not mesh at all, come back, get a refund. It's completely fine. And if you're thinking, Hillary, does your birth class check all these boxes? Yes, of course it does. I think that these are really important things. And I get so frustrated by birth classes that don't actually cover these things. And then people feel prepared, but then actually aren't prepared. That 100% happened to Hillary on her first birth. I took a hospital-based birth class and was not prepared at all. So I don't want that for you. That's why I created the birth class that will get you ready. I'll link it down below. I just want to remind you that the couple who walks into the hospital prepared will have a better experience than the couple who walks in completely unprepared. And I've seen that with my own eyes, and I know that you know that is true. And I'm here to say that the class you actually finish and you learn the material, that is the right class for you. I built my class specifically so that people like you could walk into the hospital and feel prepared. The link is down below. Now, I've talked a lot about birth classes taught by labor and delivery nurses. I actually have a whole video on which birth classes taught by labor nurses I think are the best. I'm going to link it up above and down below. So did you take a birth class? Did it check any of these boxes? Tell me down in the comments. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.